everyone. My name is Dr. Pithan Wongthanapornlert. Today I will show you about the shoulder examination and the knee examination. The first of all, we have to gain consent from the patient first. Patient come in and wash our hand too. Please confirm your name and date of birth.
My name is Peter and my date of birth is February 10, 1979.
I will perform you about the shoulder and knee. Do you have any pain on this before?
No.
No? Okay. Will you be okay when I perform you?
Yes.
Okay, thank you. Look at the camera. The shoulder examination is composed 4 steps. Look, feel, move, and special test. Let's start at the first step. The first step is look. We have to inspection. Inspection for the scar, muscle wasting, atrophy, abnormality, bruise, anything, or previous surgery scar before. Inspect at the front, the shoulder level, scar at the side, the deltoid muscle at the back, and cervical lordosis at the back, the scapula, the scoliosis, any abnormality. Okay, turn back to the camera. And the second step, feel. Use your back hand to compare to about the joint. Start at the AC joint. The increased temperature. That means for arthritis about AC joint and AC joint, and feel tender. If you have tender, tell me. Then along the clavicle, side by side. The AC joint, clockwise process, the humerus, the tuberosity, pectoral, axillary, and at the back, the clavicular, scapular border. Between border of scapula and that's the trapezius muscle. By the tickle point, do you have any pain? No. Okay, good. Compare to the both sides. Okay. Camera. The third step, move. Let the patient active movement by doing it. Okay. The first, shoulder flexion. The normal range is 180. As far as you can. Okay, 40 degrees normal. And abduction. 180 degrees, same. And cross arm. 40 degrees. Good. Okay. Fracture, table. That's it. External rotate. Okay, that's good. Internal rotate. We did. Okay. The next we have to active passive movement. When we passive movement, we have to feel the capitus or any pain at the range of motion and do the same. Flexion. If you have pain, tell me. Extension, adduction, adduction. Internal rotation. Internal rotation. And at the back. Feet in forward. Right. Look at the wing scapula. Give me a long term signal injury. It's okay. And take the scapular movement. Good. Camera. And the fourth step, it has special test. The special test for shoulder, it has for finding abnormality or any pain, any injury. Test the group, fat group. The rotator cuff test have the four muscle. Test the supraspinatus by the empty can test or jog test. Abduct 90 degrees and forward 30 degrees, and come down. I to receive my, we call it jog test too. It test for supraspinatus. The second test for infraspinatus and teres minor. This is my hand. Okay, that's good. Okay. Compare of the both sides. And I just finish. Good. Internal rotate up here. Internal rotate up here and try to supinate. Maybe here. That's good. The next test is for subscapularis. Belly press test. Put your hand, push your belly. Okay, that's good. Next test of the subscapularis, another test. We at the back. Put your arm at the back of down here and aware of try to resist my. We call it lift off test. The patient positive. He cannot resist this and cannot aware of here. Very good. Then to camera. The next test is for shoulder impingement. Near test. Stay behind. Touch around here. Full flexion. Shoulder. Do you have any pain? No. If the patient pain at the anterior point, it means subacromial impingement, and pain at the posterior, it means internal impingement. We can use Hawking Kennedy by internal rotation of this across the body. Any pain? Good. And test for the AC joint. Do the painful act. This. Do like this. And down slowly. The positive test, the patient will pain at 60 to 100 degree and will feel free at the end. That's the positive test allow here. Okay. Or use this scalp test or cross arm test at the AC joint. Like this. Okay? No. Good, very good. Okay. And the next test is for bicep tendinopathy. You can use this speed test. And try to receive my patient. It's good. Okay. And use an ovarian test. Or like this. Try to receive my. Okay, that's good. And like this. Good. The next test for instability. Put the elbow and pull it downwards. Time. Let's see in the group. Down here it means a positive test of this. This is a shoulder examination. Let's start to the knee examination too. We have to wash one hand again. It has a 4 step like shoulder. Look, feel, move. The first step, look at the both of muscle quadricep, muscle atrophy or deformity of a walker shape, virus shape, tibial. And then the patient walk toward there and come back to me, look at the gait cycle and abnormality and touching gait. Okay, that's good. Feet lie down. Okay. The second step, feel the muscle, the inflammation down here. Compare the both sides, that means arthritis from infra or osteoarthritis, static arthritis, or ligament rupture. And pocket, the muscle, quadricep, tendon, patella at the medial, the lateral side. Lateral side. And patellar tendon around here, the side, and the popliteal fossa. Maybe we call see aneurysm or cyst, the bigger cyst. And let's see let the patient teach when you need it near to the foot, full flexion of the knee. Can you? Okay, 140 is okay, normal. Now we have to passive move. Okay, and as for the hyperextension, not over 10 degrees is okay. The test indicated for effusion of the joint, knee joint. We can use this like this. Push directly at the patella, the floating of development. It's okay. Or use the swing test. Stroke upward and downward, the lateral side. The positive test will have a bulging around the medial border around here. In this case, it's okay. And the test for the ligament for the knee at the collateral ligament, medial and lateral, we use a Vargas test. Vargas test over here. This. These are medial and lateral, 0 degree and 60 degree. Good. The next test for cruciate ligament, use a Lachman test, flex 30 degree. Stabilize the femur and grab here, push anteriorly, and push directly for posterior ligament. We can use an anterior downward test by flex 90 degree of knee and sit on his foot, pull anteriorly for anterior cruciate ligament and push here for posterior ligament. In this case, normal. For PCL, we can use the posterior sac by compact two of this. The posterior sac has something about the tuberosity right here. This case is okay. The next test for meniscus pit right down the stomach. You can use a apply test, 90 degree like this for the medial, for the lateral. Do the same at the both sides, okay, and test. The positive test will end at the meniscus and right here. Okay, finish the test. Thank you. Come here. Do you have any pain?
No.
Thank you for joining me. When we finish this test, we have to wash our hand again and summarize the finding. In this case, Peter is 41 years old. He have a good muscle for shoulder and knee. No abnormality and no positive finding for any test. Thank you for watching me. สวัสดีครับ